So from follow up, next part of my video that I uploaded recently regarding my duration and dialysis. So I, like I stated before, I was on there for 12 years, and over the 12 years, there's quite a bit I learned about my ailment and stuff like that. So like I mentioned, it's coming from 3 generation. My mother have 7 of us, so 4 children out of the 7 have this disease. So it's very strong in my family, like on my mom's side. It's very strong. However, you can have this disease and don't even know that you have it. You can have it with no major symptoms. You can carry on for a long time without not knowing. However, it's very important that you get a yearly exam. Get a yearly exam so you can check your kidneys, your heart, your liver. Especially men, we have a tendency of don't want to go to the doctor. Some women as well, people in general, don't like to go to the doctor. But it's very good, very important, self-love, that you have to do a yearly exam so you can know if something is wrong. You can fix the problem before it actually escalates. However, in our situation, we have a hereditary disease. There is nothing we can do to avoid having this disease. Because when you're born with something, it doesn't matter what you do, you're going to still have it. So therefore, you can, with diet, can actually, extend your life in terms of avoiding dialysis. But it's such a aggressive disease where you can have a percentage. I'm gonna give you, for argument's sake, for instance, you have a percentage of 30% of your kidneys working January, and you decide you're gonna check by June again. You can also drop all the way down to 20-15%. It can happen like that, and I know cases where it happened like that. It goes up and down. So some of the things that the doctors will also tell you to avoid red meat, avoid the dairy products, avoid stuff that high in phosphorus, such as yogurt, anything dairy high in phosphorus, chocolate and all those stuff. It's high in phosphorus. Pay attention to your potassium level, can be very crucial as well. And a lot of foods that we love, especially ripe banana for me, banana in general, but I love ripe banana. Those stuff are high in potassium. So those stuff can actually keep you off dialysis for a long time, because all these organs that in your body, everybody work together as a team. So just imagine your kidneys work 24 hours a day, and once that is not working properly, your body gonna harbor a lot of toxin, just a lot of toxins that need to come out. So the longer you try to preserve your kidney, the better it is for you. Once you find out that you have that disease, the better it is for you. Eat right, avoid a bunch of food, like I said, fatty food, potassium, red meat and greasy food, everything, all these things process through your kidneys, and your kidney have a lot of work to do. Pills, any medications and stuff like that go through your kidneys. Like, even you notice people use a lot of protein shake. Okay, all those things, if you have that disease and don't know you have it, and you're packing your body with protein shakes, protein, it can even be more detrimental. You'll see more harm than good. The good thing is, when you're on dialysis, or once you know you have a kidney issue, you must know your numbers. Very important. They said majority of African American with kidney failure, like most black people with kidney failure, it starts from diabetes or high blood pressure, right? So that is the most common cause of kidney issue: high blood pressure and diabetes. So if your sugar is not well controlled, you're in danger. If your blood pressure is not well controlled, you're also in danger. So pay attention to those numbers. When you do your yearly lab, there are tests that they do to measure your sugar. They do this test called the A1C. It tells you how well your blood pressure has been controlled over a 3-month period, right? You can do your creatinine tests. That would be tell you the function of your kidneys, and this is varied. This is based on what I learned over the years from. There's a clinic called Mayo Clinic that give a lot of information about kidney issues. Now, for men, your creatinine function is different from a woman. The men, I think your creatinine level is 0.6 to 1.3, and for women is 0.6 to 1.1. That's your creatinine level. Now, if you do that test and your creatinine is through the roof, higher than that, it's cause for concern. Now, there is also another number that they call the GFR. The GFR is also a way of measuring your kidney as well. Now, the lower the number for the GFR is, the worse your kidney is in. Now, if you have a high GFR, say for instance you have a GFR of 60, your kidney is working 60%. If you have a GFR of 30, that means your kidney is working 30%. So you need to know that those numbers if you're having kidney issue or you suspect something is going on. But it's very important that you know your GFR and also your creatinine level. Now, if you have a GFR of like below 15, you're gonna have to start dialysis at some point, right? That simply means you have toxin build up in your body, right? And that toxin can cause nausea, vomiting. It can cause infection. You can have swelling. You can also retain fluid. You can have swelling of your feet, swelling of your face, swelling of your hands, or in other words, just your body is just swollen. In other words, because all those toxin and fluid built up in your body. Now, if that fluid built up in your body, it's very dangerous. Got two places the fluid go. The fluid go around your lungs, causing you to can't breathe, or it can go around your heart, and that is very dangerous, those two things. So a lot of people will hear that they have to do dialysis and they completely ignore the fact that, hey, this is what it is. So if you don't want to do dialysis and you have your GFR is lower than 15 or lower than 10 and stuff like that, and you decide you're not gonna do dialysis, there's only one thing: you're making preparation for your funeral, because you will not last because of all those toxin. Number one, it's gonna start affect. You might realize that you're not putting out as much urine, and your urine is toxin. In other words, all these waste coming out, these are toxin that's in your body that needs to get out. So if you're having issue urinating, it's a big problem. Now, when I was on dialysis for 12 years, I can tell you this, 9 years out of the 12, I did not pee, period, full stop. There's no pee because my kidneys doesn't work, period. I used to be on the machine for 4.5 hours. And I remember when I asked them, please just drop it down to take 15 minutes off of it. And it was still a problem because my body produces a lot of blood. My hemoglobin, which is the measurement for your blood, would always be like 17.5, 18. So that's how much body my blood used to produce. Now, with that, what they would do every month at dialysis, they would dump my blood twice a month. They would dump my blood, whenever it go through the machine and through the filter, whatever is in that line, they don't return that blood, they just dump it. Because my body have so much blood, it produces a lot of blood. So they would do that the first week of the month and the last week of every month. In other words, to actually, help to control my hemoglobin. Now, not everybody have that issue. A lot of people, hemoglobin is low, especially you're on dialysis and knowing that blood keep coming out and going in, coming out. But mine was always high. So I always run joke and said, I'm of a special kind. I'm the only person, the blood that they dump. But it is very important that you actually keep up with your treatment. Don't allow the doctors or the nurses to do everything and you don't do anything. You must know your numbers. It is your responsibility. You must have an idea what's wrong with you. You must have an idea why you end up on dialysis. Don't tell me that you don't know and you don't ask the doctor. I mean, you're supposed to know the reason why they put you on dialysis. Now, a lot of people, even for argument's sake, like the people who have a stent, because once you, for instance, you had to do dialysis emergency, for instance, you don't know that something is wrong, and you go to the doctor, they say, hey, guess what? You have to start dialysis right away. They're going to put a port in your chest. You're going to look something like this in your chest. So that port that they put in your chest, it goes directly to your heart. Now, when that thing goes in there, have to be extremely sterile. I mean, they advise you not to wet that area because it's easily you can catch an infection once you have that port in your chest. It's easy for you to catch an infection. Now, one way you can know if you have an infection, say for instance, you're home, you infection set in, you just start tremble, you like really tremble, your teeth knocking each other. That's a sign that you have an infection, right? When you go to dialysis, it will even get worse. You're on that machine, you're so cold, it's signs of an infection. Now, this area here, you cannot let it get wet when they put that port in there, or sweaty or whatever it is. But you have to make sure you keep it clean because it goes directly to your heart. Now, this is supposed to be a temporary fix where they would put this in there temporary. No more, don't let it stay in your chest for more than a year. The doctors, they will start tell you about getting a fistula in your arm. And I'm gonna show you what a fistula look like. So if you look under my arm here, I have a big old cut from under my arm, come all the way down to the front of my elbow here. So what they do, your vein is very deep. So what they do, they will have to do a surgery on you. lift your vein to the surface and get your main arteries that go directly to your heart, and they will fix it to accommodate dialysis. Now, this one here is a lot safer than the one that is in your chest. This one here takes a few months to heal. I have mine in since 2008. No major problem I have with it because it's my own vein. And a lot of people have to get artificial vein. So when you have the artificial vein, it's not a fistula, it's called a graft, right? So when it's called a fistula is when you have your own vein, right? So when they have to do artificial vein, it's called a graft. Now, with the graft, if you have a high blood pressure, it can damage your graft, right? Now, with the fistula, there are times when your fistula is blocked because of the constant sticking with the needle. There are times when it's blocked. Each time you get stick with a needle, with the dialysis needle, you're supposed to feel it. Anytime you cannot feel it, that means they are sticking the same place over and over. If you notice, for 8 years, since 2008, that's how my arm look. It really don't get too big because each time you get stick, you're supposed to feel it. If you're not feeling the stick, that means the place get really numb because they're constantly sticking that side, right? So you have to learn about your body, and if you realize that the needle stick is too hot, they have a cream that you can rub on your hand and wrap it with a saran wrap, and you really don't feel it when they stick you. Now, how long would you do that for? I guess not long, because they don't recommend that you do that for too long, right? So a lot of people, when they're getting stick, they would turn their head away because they don't want to see where they're getting stick. Remember, this arm, you own your arm. So therefore, if you allow someone to do as they have a mind with your arm, that means you're giving them to do whatever they want to do with you. So I always point to the whatever technician and say, hey, this is where I want you to stick. Even though it hurt as hell, but I would tell them, this is where I want you to stick. I don't want you to stick on top because I don't want my bum to get bigger. Some people will tell you, well, they've been doing dialysis as a technician for XYZ. I don't care. I own this arm, and I'm going to tell you where to stick me. Now, in my case, like I tell you, I produce a lot of blood. So my blood was very thick. So what they have to do, the needle that I get the biggest needle, which is number 14. So the bigger the number, the bigger the number, or the smaller the number, I think the bigger the needle, something like that. Don't quote me on it. But the needle that I was getting is the size of a mixing straw. Very big. So in order for my blood to actually go through it, because my blood was very thick. So the point I'm trying to make is, you have control of your body. If you allow someone else to take control of your body, and they will do anything. So first of all, let me recap. You must know your numbers. Very important. Stay away from the food that is bad for you. Stay away from red meat. Pay attention to to what's going on within your body. You must know. See a doctor. I recommend, if it's even once per year, right? If you can go more than once, go. And it's the best thing you could ever do. But do a comprehensive check at least once per year. Do your yearly exam. With that, you can rule out whatever needs to rule out. But don't assume that something is wrong and you're trying to use these home remedies. It's all well and good, but you must have an idea what's wrong with you. So if you don't know, you're just assuming. And when you assume, you can be taking the wrong thing, not knowing that you're actually taking the wrong thing. So know your numbers, very important. See a doctor. Don't take other people's medication, because what's good for me might not good for you. I have a friend, her daughter was taking over-the-counter medication. And what that did, like, she was taking over-the-counter painkillers. And what that do, it sent her into renal failure. Her organs start to shut down because of those over-the-counter medication. Now, this is a true story I'm gonna tell you. So 2014, I went to Jamaica. So I was taking over-the-counter some ibuprofen. I won't call the store that I get it from, but it works perfect for me. So I went to Jamaica that weekend. I came back that Monday morning, leave the airport, go straight to dialysis that Monday mid-afternoon. When I came home that night, I feel like I want to pee. Couldn't pee. There's nothing coming. I want to pee so bad, nothing coming. When I went to the hospital is like 50 minutes away from me. When my wife rushed me I was in pain. So the crazy thing about my situation, whenever I have an infection, it affects my nerve. The moment I have a fever, I cannot use my hands. My hands have no use to me. I can't even, if my phone ring, I can't even swipe the screen up. I cannot use my hands, period. So that night, the pain started to come on. I never have pain so crazy. Like, I have severe nerve issues, so I have nerve pain in my feet. When I get to the hospital, by the time I get to the hospital, I cannot walk. I try to pee, there's no pee coming. I'm forcing to pee and there's no pee. Remember what I said? I was taking over-the-counter meds. So what they did, they have to do a catheter. They have to give me a catheter, push it up my penis to get to urine to see if something is blocking it, if whatever the problem was. Now, after that, when whatever urine was in my bladder, it came out with no bacteria. There was nothing to say, well, I have an infection or anything. But you know what happened? The over-the-counter medication that I was taking, it actually caused that blockage in my bladder. So when whatever urine they pull, it looks so cloudy, like milk, like something settled at the bottom, like very jugsy. It would look like when you mix this tea called Horlicks. The top is creamy, and then at the bottom there's just a bunch of dust, cloud at the in the container, whatever they pull that urine from me. There was no bacteria growing, but I couldn't pee. I wanted to pee so bad, but there was absolutely nothing. So about a week after everything all said and done, I get released from the hospital. I thought about something. I said, if there's no bacteria, what causes this fever? Or what, caused me to have this pain? So I take some of the pills that I was taking over the counter. And what I did, I put them in a glass of water. I think it was about 3 or so pill. I drop in a glass of water, throw some water on it, and leave it overnight. The color of the pill was kind of burgundy, dark brown. I would say dark brown. In the morning when I wake up, it have the same texture or the same color of the urine that they pull from my bladder. What causes it? When I showed the doctor, the over-the-counter medication was what causes that problem. So be careful with over-the-counter meds, like I would say, like ibuprofen, Aleve, and all those stuff. Those stuff can actually hurt your kidneys. Everything that we take, every pill or tablets, whatever we call it, break down by your kidneys. So your kidney have a lot of work to do. And if we are giving junk into our kidneys, guess what's going to happen? Your kidney is going to give us the same junk result. So the point is, be careful of the stuff that you take. Read labels. Read what you can do, what you learn something about your ailment, learn something about your body. Pay attention to the stuff that we put in our mouth. Stay tuned for the next video.